Good morning, dear students. Failure will never overtake me if my determination to succeed is strong enough. If you fail, never give up because fail means first attempt in learning. End is not the end. If fact end means effort never dies. If you get no as an answer, remember no means next opportunity. It is said by APJ Abdul Kalam. So let's be positive and start learning. So, today we are going to start with a new topic, ovarian cyst. Definition: ovarian cyst is a small fluid-filled sac that develops in woman's ovary. So, it is the cyst that is formed by small fluid-filled sac that develop in the woman's ovaries. We can see the risk factors of ovarian cyst. First is hypothyroidism. Second, infertility or women who are on treatment of infertility. Third, those taking tamoxifen, a drug to combat breast cancer. Irregular periods, early periods that is before 11 years, and previous history of ovarian cyst. A drug called clomiphene may lead to formation of corpus luteum cyst. So clomiphene is it is drug for infertility. It is treated for primary pituitary or ovarian failure. Next, endometriosis. We already studied in the previous class. Then increased upper body fat distribution. These are the risk factors of ovarian cyst. Next, we can see the pathophysiology. Normal process. During ovulation, the ovary produces a hormone. This hormone makes the follicles to grow and the eggs within it mature. Once egg is ready, the follicle rupture and the egg is released. It's a normal phenomenon. The follicle changes into small sac called corpus luteum. If follicles is not rupturing, it changes into its smaller size or doing the rupturing itself. So follicle that is larger than about 2 cm, that is known as ovarian cyst. So it is happening when it is not ruptured. So that will remain there and become a small size, and sometimes it rupture itself also. So that is known as ovarian cyst. We can see the type of ovarian cyst. First is follicular cyst. This is the follicular cyst. This is the corpus luteum cyst. First, we can see the functional cyst. Different types of ovarian cyst. First is the functional cyst. It's functional cyst that develop as the part of normal function of the ovary. So, normal function of the ovary is the development of the this follicle and maturation and ovaries release. So in the normal cycle, when it cyst develop, that is known as functional cyst. It can be classified as follicular cyst and corpus luteum cyst, just before we see in the picture. So follicular cyst, that is 6 cm in diameter. It occurs due to follicle fails to rupture. It usually dissolves within 1 or 3 months time. So that is a follicular cyst. That is not much problem. Then corpus luteum cyst. It is caused by the malfunction of the corpus luteum. Occurs after an egg has been released from the follicle and fills with the blood and fluid and remains in the ovary. There will not be any symptoms no larger than 6 cm. So this is the difference between the follicular cyst and corpus luteum cyst. This is formed by the follicles fail to rupture. This because of malfunction of corpus luteum. So that is the first is functional cyst, that is divided into follicular cyst and corpus luteum cyst. Next is the hemorrhagic cyst. Hemorrhage is from the name itself we can understand. Hemorrhage is bleeding. This type of functional cyst occurs when bleeding occurs within the cyst. So we can see from this picture, this is the hemorrhagic cyst. This type of functional cyst occurs when bleeding occurs within the cyst. Next is the cyst adenoma. This type of benign tumor that develops from ovarian tissue filled with a mucus type or fluid-filled material. It measures 12 inches or more in diameter. So this is the this cyst adenoma is developed from the ovarian tissue. So usually it fills with the mucus type or fluid filled type. So we can see the filled with the watery or the fluid type. It is known as serous one. Serous one, you can see the picture. This is filled with the watery type. Next, mucinous type. Mucinous type is filled with a sticky, thick, gelatinous material. There is a sticky gel type material. So you can see the picture. This is the mucinous type. So cyst adenoma, it is two types appears, that is serous type and mucinous type. Next is the dermatoid cyst. So ovarian neoplasm. It is also known as ovarian neoplasms. It consists of, so this is dermatoid, dermis. Okay, so that is skin. So from the name itself we can understand. It consists of skin or related tissues such as hair, teeth or bone instead of fluid. Develops from the ovaries germ cell and it may grow 6 inches in diameter. You can see the picture. This is the dermatosis. You can see from this picture. This is the like a teeth, bone forms. Okay, instead of fluid. Next, fifth one, endometriosis or endometrioma or chocolate cyst. We already studied in the previous class about endometriosis. When it become rupture and forms, it lays down and become a chocolate like a cyst, blood filled sac. Okay, it is filled with a dark blood. You can see from this picture, and it results from endometriosis. We studied in the previous class about the endometriosis. So this endometrium, when implanted other than the uterine cavity, so where the remnants is fall, it mature in each menstrual cycle, develops and rupture, like that. It forms like a dark blood formed cyst. It forms when endometrial tissue forms in the ovaries. You can see from this, there are ruptured chocolates. It is like a chocolate cyst. This is the endometrial cyst. Next, sixth one. This is the next. You may be heard about the polycystic ovarian system. Of most of the girls nowadays are become facing this problem, polycystic ovarian syndrome. You can see the polycystic ovarian syndrome. It's a normal ovary, but there is a lot of cysts are formed in the ovary. It is more. We can see polycystic ovary. When the follicles never erupt from the ovaries, it is associated with the infertility, abnormal bleeding, miscarriage, pregnancy related complications may be occur. So it never rupture or erupt from the ovary. That is known as polycystic ovary. Next, so till now we seen the different types of the cyst, that is a functional cyst, that is divided into follicular or corpus luteum cyst, hemorrhagic cyst, cyst adenoma, that is serous and mucinous type, dermatoid cyst, endometrioid cyst, that is polycystic ovary. Okay, so this type we seen in different types. Now we can see the histoclinical presentation of ovaries. The majority of ovarian cysts are asymptomatic. Pain or discomfort may occur in the lower abdomen. Torsion or twisting. You can see from this picture, this is a twisting. You can see this is ovary and this here is a twisting occur. So torsion or twisting or rupture may lead to severe pain and patient may experience discomfort with the intercourse, particularly deep penetration. Having bowel movements may become difficult or pressure may develop leading to desire to death. Always feeling like it is not complete, like something again feeling to after defecation also a person may feel to defecate. This frequent feeling of defecation because of this pressure system symptom due to this cyst, large cyst. This is the torsion of ovaries. This is a complication problem. Because of this torsion there may be rupture occur. Next symptom is maturation may occur frequently. So this is also because of the pressure symptom in the bladder, frequency of maturation. So sometimes patient may came with the symptoms of lower abdomen pain, and she may be having this problem like pressure symptom, frequency of maturation and frequency of defecation from few months. Okay, so we can suspect that is a this is a ovarian cyst, and patient may experience abdominal fullness and bloating. Endometriomas are associated with the endometriosis, which causes a classic triad of painful and heavy periods and disturbance. So this is the main symptom. Endometriosis related classic triad of symptoms is painful and heavy periods and dyspareunia. Then patient with polycystic ovarian syndrome present hirsutism. Hirsutism. Okay, so hirsutism means abnormal hair growth, infertility, oligomenorrhea, obesity, and acne. Acne is the severe, it's a prolonged pain, dull pain. That is the acne. So this is the if the patient came with the symptoms, you have to note that infertility is because of the this reason is leading to the infertility. So these are the symptoms of ovarian cyst. Next we can see the physical finding. A large cyst may be palpable during the abdominal palpation. Sometimes discerning the cystic nature. Discerning means having the cystic nature of an ovarian cyst may be possible. And it may be tender to palpation. Then if the cyst is huge, the cervix and uterus may be pushed to one side. These are the physical findings. Next in the bimanual examination. When we are doing the bimanual examination, uterus is separated from the mass. We can see when this is the bimanual examination. So if the cyst is here, we can see a groove. It is different from the uterus. In this picture there is no cyst, but if there is a cyst, here will be cyst formed. So when we palpate it, we can see the different or groove. Groove means a deepness. If the cyst is here and normally uterus is here, so when we palpate, we can see a groove. Okay, and uterus is separated from the mass, and groove is felt between the uterus and the mass. Next is a sonography. So transvaginal sonography with the color flow Doppler study will give the information about the tumor, volume, cyst, wall, septa, and the vascularity. This is the, you can see the with the color Doppler study, you can see the transvaginal sonography. This is the big cyst. It's a 6 cm cyst. Then laboratory studies. No laboratory tests are diagnostic for the ovarian cyst except for the PCOD, for which hormones assays are done. Only in the PCOD condition, the laboratory test, that is FSH, LS, testosterone estradiol, can be checked. An imaging study, we already seen the ultrasonography, Doppler flow studies, MRI, CT can be done to confirm the size and the type of cyst is formed. Next is the management. Pain relievers, that is acetaminophen, NSAIDs, narcotic pain medications can be given. Warm bath or heat baths or hot water application can be applied. And functional cyst, if it is a functional cyst, wait and watch. We already explained you, if it is a functional cyst, then it will disappear within 1 to 3 months. Okay, so that's why we have to wait and watch. If more than 2 inches, laparoscopy and remove the cyst. Otherwise, just wait for the EC to disappear, or not, just wait and watch. Next, if the functional cyst wait and watch approach is taken, if more than 2 cm laparoscopy and remove cyst. If cyst comes and goes, then oral contraceptive pills can be given. You can see the picture. This is the ovarian with the cyst. Next is the polycystic ovaries. If infertility, patient, because of the polycystic ovaries, patient is complaining of infertility, Clomid, that is the anti-estrogenic agent. It is non-steroidal infertility agents to stimulate the ovaries. So when we given the Clomid, that stimulate the ovulation and ovum will mature and rupture. If not trying to conceive, no periods, then Provera is a contraceptive injection. So if not planning for a baby and not trying to conceive, then we can give the injection Provera, so it will restore the normal menstrual flow. Okay, so that is the contraceptive injection. This is Clomid 50 mg. Then this is the Provera and this is the Clomid. Next is the if it is an endometrial cyst and cyst adenomas and dermatosis, what management can be done? This is the surgery, laparoscopy. If small cyst is the ovarian cystectomy can be done. This is the ovarian cystectomy. We can open this ovary and we can remove the cyst. And partial oophorectomy. You can see the partial, so one ovum there is partially can be removed. Then salpingo-oophorectomy, you can remove the tube and the one ovary. Okay, that is salpingo-oophorectomy. Then if the patient is completed her family, then take abdominal hysterectomy with bilateral salpingo-oophorectomy can be done. This is the endometriosis, cystadenomas and dermatosis. That's all about the ovarian cyst. Till now we discussed about what is ovarian cyst, what are the risk factors of ovarian cyst, what are the signs and symptoms, and what are the different types of ovarian cyst, and what can be the management done according to the type of ovarian cyst. I think all of you are clearly understood. Thank you.